For centuries, people suffered from the potentially fatal, crippling effects of many serious diseases such as smallpox, polio, diphtheria, and measles. In the 1950s, science gave us the gift of vaccines, and people celebrated. Yet today, a small portion of our population prevents their families from having access to these vaccines. Why?
The number of measles cases linked to the Disneyland theme park continues to grow.
Doctors weigh in and sound the alarm.
Vaccines are one of the greatest achievements in the history of public health.
We thought we had measles essentially licked.
So why is this disease coming back from the brink of extinction?
People are deciding they're afraid of vaccines.
They get this monster shot. You ever see the size of it? It's terrible.
We vaccinated our baby and something happened.
When someone's already sucked into that myth, it's a very difficult thing to talk them out of it.
Initially, in the 1950s, people followed science and their doctor's recommendation, and they lined up to get vaccinated and protected. Recently, some are being influenced by the media, politicians, and entertainers, and we are now starting to see the consequences.
The CDC reports the measles practically wiped out tonight in the United States.
Unfortunately, those reports were premature, with over 600 measles cases reported in the U.S. in 2014. Measles can be fatal. The World Health Organization estimates that the vaccine prevented 15.6 million deaths in a 13-year period. It is also highly contagious. If you're not vaccinated or less than 1 year old, immune compromised from cancer treatment, AIDS, or HIV, or if you're part of the 2% where the vaccine was ineffective, you have a 90% chance of contracting the disease if you come into contact with someone with it. Liz Pino is a BSRN with experience in Boston, New York, and Denver in an ICU.
I'm a nurse in a pediatric intensive care unit, and I have seen the devastating effects of children who become ill with vaccine-preventable diseases. I also take care of children who have weakened immune systems, like kids with HIV, cancer, or have had organ transplants, and they could get very ill if they were to contract a preventable disease like measles. That's why it's important for everyone to get their vaccines so we can protect these children who are unable to protect themselves.
So how we protect each other in society is by attaining what is called herd immunity. And that is where 92 to 94% of the population is vaccinated, and thereby those that are immune compromised or not vaccinated because they're under 1 are protected.
Here in Marin County, California, you have pockets of people who are not vaccinating their children. There are certain schools and communities where that rate is as high as 50%. And what I fear is that we have an epidemic of measles, an outbreak, and that we have children that are very ill or that die.
Author Seth Manookin explores the fear of vaccines in his book called The Panic Virus.
The current vaccine scares and controversies that we're still dealing with today stem from a 1998 paper that appeared in The Lancet, a very respected medical journal published out of the UK.
This study was conducted and published by Dr. Andrew Wakefield, and he stated that there might be a connection between the MMR vaccine and autism. He also recommended that parents do not vaccinate their children.
The notion that you would take a 12-person case study and make claims about a population as a whole is ridiculous.
News organizations should exercise judgment about what goes out over their air. What's particularly important is to think about the overall scientific consensus. Where is the weight of the evidence, and is our reporting reflecting that or not?
It's time for everyone to redirect the questions toward finding the cause of autism. It is not, however, vaccinations.
Controversial subject, Nancy.
Not controversial subject.
Well, but controversial for parents who still believe.
It is not controversial, Matt. It's time for kids to get their vaccines.
Everyday people can't be fact checkers for every story about vaccines. And when journalists don't give people the weight of the scientific evidence, they're letting them down.
For me, I want that to be my choice as a parent. And you know what? I know my kids best. I know what morals and values are right for my children, and I think we should not have an oppressive state telling us what to do.
By asking, did you really just say to Laura Ingraham that you think most vaccines in this country should be, quote, voluntary?
Well, I guess being for freedom would be really unusual. I guess I don't understand the point, why that would be controversial.
Senator, maybe you're not aware, but there's a huge problem right now with Disney theme parks having to close down because of mumps. Not enough children being vaccinated against measles, mumps, and rubella because their parents, for whatever reason, have decided that it is voluntary.
It's plain and simple. It's bullshit.
No, it's...
Yes, it is.
Without a doubt in my mind, I believe vaccinations triggered Evan's autism. So I think they need to wake up and stop hurting our kids.
There may not be a doubt in her mind. The problem is that the credible medical and scientific communities say she is wrong, that numerous studies have found no link between vaccines and autism.
As a national entertainer, Jenny McCarthy has a great platform for her opinions. But in this case, her position is based on emotion, not fact or science. This chart shows how the vaccine complexity has been simplified over the years, yet autism rates continue to grow.
I'm a pharmacist at a children's hospital, and I can tell you that vaccines are one of the safest, most effective forms of modern medicine today. For example, the MMR vaccine is 93% effective after 1 shot and 97% effective after 2. This vaccine costs only $1 and is one of the most cost-effective ways that you can prevent your children from becoming ill.
3 very prominent and reputable health and science organizations have come out in support of vaccinations. The National Institute of Health conducted international studies and found no correlation between vaccines and autism. Also, 2 autism societies have done research and studies and found no correlation, and they recommend that children get vaccinated.
Jenny McCarthy coming on TV and claiming that the vaccinations had caused autism for her son, and that has been really just something that has scared me to my core as a mom.
A lot of people calling Orange County the ground zero for the measles outbreak. Does that concern you at all?
The numbers are still low enough where it's not so much a concern for us.
My kids are in jeopardy with kids that aren't vaccinated, and I don't know anybody that doesn't vaccinate their kids.
But then aren't you benefiting from everybody else doing the right thing?
You know, that's a good question. Yes, definitely, obviously, I'm benefiting from that, but I'm not trying to fly under the radar.
It's disappointing to see that Colorado is one of the lowest vaccinated states in the country at 86%. That leaves 1 out of 7 people vulnerable to this disease. And those at risk that will suffer the most are going to be infants, pregnant women, children of poor families, and those with immune-compromised systems. It's not surprising that people get confused and make the wrong decisions, with entertainers, media, politicians, and one corrupt doctor giving misinformation to the public.
What does it take? How many times do you have to tell people or talk about it? We all have a role in helping each other to protect each other. A vaccine-preventable disease should not have killed my son.